Hello, my name is Melissa Williams. The two studies I will be discussing with you today are about atrial fibrillation induced by endurance exercise. Atrial fibrillation um, is an irregular heartbeat that can cause stroke, heart failure, or other cardiovascular diseases. It's also called AFib or AF. In the ECG, you'll typically have irregular R-to-R intervals, absent of distinct repeating P waves, and irregular atrial activity. Here is a video just showing you what AFib may look like in the heart. Typically, exercise is known to provide many health benefits by improving disease outcomes in cardiovascular patients. The research I will talk to you today about shows that high intensity endurance exercise increases atrial fibrillation susceptibility. Research shows that continuous high intensity exercise training may induce cardiac remodeling, which is changes in the heart size, shape, the structure, and the function of the heart. During this particular research study, they found ventricular arrhythmia vulnerability involving the right ventricular fibrosis, which is an excessive fibrosis tissue in the myocardium. They found dilation and dysfunction in the rat model. Some data show the intense exercise training, like marathon runners, cyclists, and cross country skiers, are at high risk for developing AFib. AFib isn't just limited to those elite athletes, but also men 50 and younger who jog. It's unclear if the mechanisms of AFib is induced by regular high intensity exercise. So, if we can get a better understanding of the mechanisms related to AFib, then we would improve therapy approaches, set new guidelines and outcomes for the future. So what the researchers sought to find out was, will endurance training induce AFib in rat models? And if it does, what are the potential mechanisms? The methods used to test this study were program simulation involving rats, which were used to assess AFib susceptibility. The rats trained 1 hour a day on a treadmill, training 5 days per week. The test subjects were rats, exercise, de-exercise, and sedentary rats. The sedentary rats were the controls for the exercise in the de-exercise group. The program included an initial 1 week progressive training programming, increasing to a steady state 60 minutes running at 28 meters per minute. If the rats weren't able to complete the training at this rate, then they were excluded. The rats were assessed after 8 weeks and 16 weeks. They were also assessed 4 weeks and 8 weeks after the exercise training ended. Tests used throughout this study were electrophysiological study. It was used to evaluate an abnormal heart rhythm, followed by cardiac incision, which was used for the surgery procedures. And the cardiac remodeling was assessed by echo. We will now look at some of the data collected found in this study. In figure A, it shows recordings during atrial fibrillation induction. In majority of the sedentary rats, no AFib could be induced. The bottom left here shows one exercise, shows the EKG of one exercise rat, which had inducible non-sustained AFib, which in some cases were self-terminating. On the top right, it shows an EKG of one 16-week exercise rat, and it has sustained atrial fibrillation. Figure B shows inducibility rates for sustained atrial fibrillation and non-sustained AFib at 8 and 16 weeks. No clear AFib promoting effects were shown in 8 weeks of training. As you can see, this is the non-sustained AFib and this is the sustained AFib. It's not a big difference there. Uh, but the 16-week, as you can see, had a significant increase in AFib inducibility. It was sustained AFib was seen in 9 out of 14 of the rats, which is 64%. And out of the sedentary rats, just 3 out of 20, which is 15%. Figure C shows inducibility rates for sustained atrial fibrillation with extra stimulation techniques. Exercise sustained AFib was induced by extra stimulation in 5 of the 14 exercise rats. All right. The next data model I'll be showing you it shows the echocardiographic atrial dimensions. The atrial size with exercise for the diastolic left atrial dimensions upper panel. And B shows us the body weight index results. And as you can see, no significant differences were found here. C shows us the photomicrographs of red stain samples. As you can see, there's a larger, thicker amount of fibrotic strands in the trained rats. And D shows image analysis that indicates that 60% of significant increase in fibrosis tissue content was found in the atrial with the exercise training. So to sum it up, this study found that endurance exercise training does promote AFib vulnerability. The exercise rest showed a cardiac type similar to those of a trained athlete, including ventricular hypertrophy and atrial dilation. No clear changes were found at 8 weeks of exercise training, but 16 weeks exercise significantly increased the sinus rhythm and Winkiebox cycle length, as well as induced vagal tone. 5 rats in the exercise group showed long-lasting induced AFib greater than 15 minutes. The long-lasting AFib-induced rats were given atropamine, a medicine used to treat bradycardia, to assess the vagal tone, and it terminated the AFib in all of them. In 4 of the 5 rats, the AFib couldn't be reinduced after the atropamine. All the electrophysiological differences between exercise-trained and sedentary rats resulted in 4 weeks of detraining. Structural remodeling was different. The fibrosis tissue content remained increased after 8 weeks of detraining. The left atrial enlargement failed to recover with detraining, but the right atrial recovered at 8 weeks, but still had a significant enlargement at 4 weeks of detraining. So just like athletes, so just like these rat models, athletes also develop AFib after prolonged high intensity exercise training. With shorter periods, the AFib risk were very low. And throughout this study, the overall results showed that there was a rapid reversibility of AFib. All right. The next study shows that in intense endurance exercise like swimming or treadmill running for 6 weeks increases susceptibility to AFib in mice and is associated with fibrosis. A feature of endurance athletes is heart rate slowing due to elevated parasympathetic tone and atrial hypertrophy, both risk factors for AFib. Intense physical activity also elevates inflammatory factors. The, the test subjects of this study were mice. The groups were treadmill exercising mice, swimming mice, and control group mice. The program consisted, the swimming mice swam in containers 30 centimeters long and with a steady water current generated by a water pump. The running mice trained on a treadmill at 35 centimeters per second with a 30% incline. The control animals were placed in water containers without water current for 5 minutes or placed on a treadmill for 5 minutes. All the assessments in this study were conducted 24 hours after the final exercise session. And the duration of length of the study, the swim mice training began with 30 minutes of swimming sessions twice daily, separated by 4 hours, that were increased to 90 minutes by adding 10 minutes per day. Then the duration of 6 weeks. The running training mice began with 30-minute sessions that were increased by 10 minutes per day to equal up to 120 minutes. Some test measurements in this study were VO2 consumption measurements, echocardiography, electrocardiography, heart rate variability, and the others listed here. So the first data model in this study shows the increased vulnerability to atrial but not ventricular arrhythmias in exercise animals. A shows us the electrogram recordings showing the induction of ventricular arrhythmias, tachya arrhythmias, sorry. B shows us the sedentary swimming and treadmill exercise mice, and that the percentage of them, the percentage of AFib in those were less than 10 seconds. C shows us that the ventricular tachyarrhythmias weren't increased, and D shows us that it increased significantly by exercise. E shows us the typical representation of AFib. It shows us the rapid stimulation recorded using a field recording and optical mapping images. And F shows us the percentage of the isolated atria from each group showing sustained atrial fibrillation episodes. So the next data model shows the effects of atrophamine on AFib susceptibility in exercise mice. So the administration of atrophamine had a larger effect on the heart rate in the 6-week swimming exercise compared to the sedentary mice. In figure B, it shows that there were consistent increased parasympathetic nerve activity. The 6-week swimming exercise mice had increased high frequency power compared to the sedentary mice. The relation between the heart rate and the heart power is shown here, frequency power is shown here. In C, this shows you the change in atrial effective refractory period after the atrophamine was greater in the exercise mice compared to the sedentary. And D shows you that the atrophamine reduce the duration of the AFib in the exercise mice. And they were thinking that the role of the parasympathetic nerve activity and AF susceptibility in the exercise mice had a role in exercise, had a role in the AF susceptibility. All right. So the heart rate in this study overall, the results conclude that there was increased parasympathetic nerve activity and structural atrial remodeling characterized by inflammation, hypertrophy, and fibrosis. And they also found the increase in atrial fibrillation vulnerability in intense exercise mice. There were no differences in the beating rates of the isolated atria between exercise and the sedentary group. There were heart rate differences resulting from the exercise. Uh, they were blocked by the autonomic nervous system combined with the atropine and the propranolol treatment. Uh, the exercise induced reductions in the heart rate arise like primarily from the autonomic nerve activity, which is typically seen in athletes as well. Ventricles of the exercise mice also underwent physiological remodeling, as in athletes, characterized by left ventricular chamber enlargement. This study found that increased parasympathetic nerve activity and structural atrial remodeling, inflammation, hypertrophy, and fibrosis increases the atrial fibrillation vulnerability. All right, so some similarities between the two articles were that they both support each other in finding that atrial fibrillation is induced by high intensity exercise, but they also found that it's it's easily reversible once you stop training. Both studies showed that they support each other in that they both found atrial enlargements. Both studies showed that atropine reduced the duration of AFib. And in one particular study, uh, once they were administered the atropine, the atrial fibrillation wasn't able to be re-induced. One way they contradicted each other was one study had no changes in 8 weeks or found no significant changes in 8 weeks. And the other study found changes in 6 weeks that showed the induction of atrial fibrillation. Thank you all for taking the time to watch this.